off of people's deepest health secrets. Health reporter Haley Hernandez joining me now with more on this.
Yeah, how you like them apples?
Oof.
So we're talking about the apps that you download on your phone and access a therapist, not just when you see a therapist and then you talk to her online on a computer, on a phone, or something like that. We're talking about apps like BetterHelp and Cerebral are the ones in particular. You know, you're accessing a therapist through their service. So you're signing away stuff in the beginning that you probably didn't know. And again, some of these things were done secretively. So this is going to impact a lot of people. These apps, I mean, they soared, they skyrocketed in popularity during the pandemic when we really started witnessing the mental health crisis unfold. And then we saw people wanting that access from their isolation, right? It was during COVID times. And people have continued to use them, of course. So these apps are convenient. They've got therapists there day, nights, weekends, odd hours. There's therapists available all the time. But even though they're cheap, consumers might be paying a huge price. This month, mental health apps BetterHelp and Cerebral are facing big penalties for violating your privacy. First, the Federal Trade Commission is requiring BetterHelp to pay $7.8 million for, they say, deceiving consumers after promising to keep sensitive personal data private. Then they turned around and they sold your data to companies like TikTok, Facebook, and Snapchat. While the app Cerebral is also in trouble after admitting to its patients they've been using tracking technologies to share user data with third parties. Now, Cerebral claims to some news outlets that this was inadvertently shared. A local Houston therapist I sat down with, as you see her there, she still says that these apps need to be held accountable because violating mental health privacy, she claims, is more vulnerable and predatory than other data breaches.
The therapist interaction with the patient is different. It's not like going to the doctor where you list symptoms and then you get a prescription. It's more personal, it's unique, it's very private. There are things that you say to your therapist that you don't say to anyone. So we are out here kind of expressing these vulnerabilities, and having these online platforms take those vulnerabilities and selling them to market it back to us is very predatory, because again, that information that we share with our therapists is extremely private.
What's going to happen now to those people who they bought into it because of all of those other conveniences? Now, what if they don't have a backup plan for therapy? Like, what can they do?
Right, so it's a great platform in the sense that there is accessibility to individuals who might not be able to get counseling. With that being said, if you did buy into it, now you feel stuck, I would say what's more important, your privacy, making sure whatever I am saying to my therapist is confidential, or counseling itself. And what I would recommend is the privacy. Meaning, if you and your therapist are having a conversation, it's not private, then it's not true counseling.
Now, Dr. Riaz says, you know, in a world where we've become numb to these types of privacy violations, right? She still says that this one in particular is predatory, unsafe, and disgusting. Those are her words. So she encourages you to ask yourself, am I comfortable with having my information sold? If you don't care, the answer is yes, you're comfortable, then you can continue using those services, of course. But if not, she suggests that you write an email to the company addressing that they have breached your personal information, and what are you going to do about it? She also says that you have the right to contact an attorney. So she does say that she thinks that in some cases it should go that far.
Yes.
And Haley's here to talk about the fact that a lot of people don't know the symptoms, the signs that they're having, or someone they know is having a stroke.
Yeah, they don't know the signs. And listen to this fact, about 1 in 3 victims never even called 911. Wow. This month is Stroke Awareness Month. So this morning, we really want to dive into understanding the signs that you're having a stroke and just simply to raise awareness. Joining me now is Dr. Purse, the City of Houston Health Authority. Good morning, Dr. Purse.
Good morning, Haley. Thanks for having me back.
So some people might be familiar with an acronym FAST, and now we see the acronym Be Fast. Can you tell us what does that stand for? What exactly does that mean?
Yeah, so the FAST is the acronym that, first of all, the F stands for face. So a lot of times when people are having acute strokes, there will be a change in their ability to control their facial muscles. So most people smile, and it's the same on each side. If one side doesn't go up, then that's one thing to look for as a possible stroke. Also, the A stands for arms. Now, it's not just that you can't raise your arm, but even the loss of grip strength could be a sign that somebody's having a stroke. And S is speech. So speech impediments, people slurring their words, or sometimes it's just people, the words don't make sense. So they can speak just fine, but the words coming out don't make sense, or there's long pauses as they search for a very common word. So inability to speak properly. And then the T stands for time, is where it's going to be fast, not just the fast, you got to be fast. Because as you point out, a lot of folks will delay. In fact, we find that some people having strokes, in fact, many people having strokes, will wait a whole hour before they call 911 or seek help. And the problem with that is we've only got a few hours to treat somebody if we want to reverse the stroke. And we can do that now with certain medications. We can actually reverse the stroke, stop it. But it's got to be done in those first couple of hours. So every minute wasted is a minute lost.
Can you clarify, does somebody recognize these symptoms in themselves, or does it take somebody looking at them to recognize the symptoms?
Well, like I said, nobody wants to have a stroke. And so very often the person having the stroke will go into denial and pretend that it's something else that's causing their inability to speak, or their inability to use their arm, or their inability to walk. It's a denial. And so a lot of times it's their person who's with them, a spouse, another family member, a good friend, or sometimes just a bystander, has to recognize that something has dramatically changed. And so it can be the patient. They a lot of times don't want to know this, or it's going to be the other person who's going to step up and say, listen, you're having a serious problem. I'm calling 911.
And that's the delay with people calling 911 a lot of times, is that the denial gets in the way of calling too.
That's right.
Yeah. So what are some of the most common risk factors for having a stroke?
So anything which will damage your blood vessels. And so these are things which occur over lifetime. So cigarette smoking, if you're diabetic, high blood pressure, high cholesterol, and unfortunately also some of your own genetics. So if you've got a family history of people having heart or stroke problems, you need to pay extra special attention. Now, the thing is, with a lot of these risk factors, you do have control over them, right? So you can choose not to smoke, or you can get help stopping smoking. If you're diabetic, you need to be really diligent about controlling your sugar levels. Also, exercise. If you exercise a lot, aerobic or not, you just get out and exercise. And I don't mean marathon running. I mean just walking 30 minutes a day is helpful. But these are all things which will reduce your stroke level, and they are really important because they really, really make a difference. And the other thing I want to point out is that here in Houston, we're really lucky. Across the nation, more people are having acute strokes, per capita, get treated here in Houston. We have very aggressive stroke programs at our local hospitals. In fact, Houston was the first city in the United States to have a mobile stroke ambulance with a CT scanner right on the ambulance. And so, if you're going to have a stroke anywhere, you probably want to have it here in Houston. But even here, you still need to recognize the signs and symptoms and call early in order for us to be able to reverse that stroke for you.
Yes, Dr. Perce, you're so right. And I'm a big fan of that mobile stroke unit. I just hope that we can eventually see it all over the city and all over the nation, really. More places need to have that. Can you explain some of the complications that would happen, though, if you don't get to a hospital in time, if you don't recognize that these are signs of a stroke? What could then happen to you?
Well, the brain is a very complicated organ, right? And once the damage is done, if you have a small stroke, sometimes the brain around it can make up for it, but larger strokes, the brain can't make up that difference. So people can wind up with permanent paralysis. And then when that happens, then the muscles will contract. People can wind up with permanent breathing problems. They can wind up with permanent problems just thinking straight. They can wind up with permanent problems speaking. And these are all things that we need just day to day. Just the quality of your life is dependent on your ability to think clearly, communicate with others, and to move around to the best of your ability. And you can lose that with a stroke. But again, if you recognize the symptoms early and you call, there's a good chance we're going to be able to minimize, if not eliminate, your stroke.
Dr. Perce, this was all really helpful information. And based on the risk factors that you mentioned earlier, it sounds like a lot of people in America could be at risk for a stroke. So we really appreciate you breaking that down for us and helping us to understand that shouldn't delay calling 911 is one of the most important things, but understanding the symptoms as well. I appreciate your time this morning.
Thanks, Haley. Thanks for asking.
Yeah, just a personal note too. I mean, I had suffered personally stroke-like symptoms in the last few months, and
Oh,
that
my goodness.
timing, because we hadn't had a chance to talk
No,
about
this is the first I'm hearing about this.
I just want to follow up on what the doctor was saying, because the timing is so important. They looked at me at Methodist Hospital. God bless Methodist Hospital. They're fantastic. And they said, well, look, if we wait to figure out if you're having a stroke, it's going to be too late to give you the clot-busting medication.
Yeah.
So we had to decide on the spot. We don't know if you're having a stroke, but should we give you this medication?
Was there any harm in giving the medication?
There's potential for internal bleeding. There was some of that, but they looked at my
But
risk
you're in
and
the
they
hospital.
said, yeah, you're here anyway, so
Yeah.
we keep you for observation for 24 hours. It's expensive, but let's just do it to protect you.
Yeah.
So again, time is of now.
And then,
clean bill of
thank
health
God,
right now,
you're
thankfully.
somebody who has insurance and who has
right.
the, ability to go to the hospital. That's also another problem for a lot of people, is that they just don't even have that as an
In
option.
terms of those risk factors they spoke of, afibrillation is another one, because in between those arrhythmic heartbeats,
Yeah.
clots can form, strokes can happen, and that's one of the things I learned from this experience.
Really? Wow.
Yeah. So
Yeah,
luckily,
another thing
I
that's
don't
like
have AFib, and luckily it all.
But
came
it is
together,
another thing
but-
that's super common, which is making a lot of people at risk of a stroke, and they don't even think about it.
Right.
Yeah.
Right. So one other note of this,
Good job
because
sharing that.
FAST and Be Fast, those acronyms are really interesting and clever if you speak English. But for
Right.
Spanish speakers, it's been harder to get the message out.
Yeah, so this is important because Hispanic people living in the United States have a high risk of dying from a stroke. So UT Health Houston has created an acronym, Rapido. Here's the acronym on your screen right now. It includes the 5 most common symptoms of a stroke, and it includes the message to act quickly by contacting emergency services. This is all in Spanish, so send it to Los Padres or Abuelitos. It's a little longer than the FAST acronym that is in English, but it's a good option as far as Spanish speakers go. Best we have so far.
Yeah, very important. And again, you can share that with your family members that need it. And don't forget, click2houston.com/scene7. You can see all of our weekly segments that Haley has with Dr. David Pearce. Thank you, Haley.
Yeah, thanks for sharing.
And we'll catch up, too, on my trip to Methodist.
Please, yeah.
God bless those folks. Health reporter Haley Hernandez explains how to warn your teen about it. She's here with me live. Good morning.
Hey, yeah, so when I went to the Council on Recovery, it was to find out about, how to talk to your teens, what they need to know about drugs. And what I found out is that there's a lot of common questions that parents want to know. And the number one question that the experts say they get from parents is about boundaries. Can I search my child's room? Owen, the answer?
Heck yeah, 1,000%.
Well, they agree with you. Their answer, of course, you pay the rent, you pay the mortgage,
Nice.
You can definitely look. And it's perfectly okay to even tell them that you have this right and you're probably going to do it. But if it's going to be something that keeps them healthy, it keeps them alive, then the Council on Recovery says do it.
Okay, so we've talked about fentanyl deaths. When curiosity kills,
Yeah.
because we don't assume children are going to take their own lives with a drug by accident, right? I mean, this is, I don't want to say part of growing up, because not every child does drugs, but for those that have that curiosity, this is something we didn't have to deal with growing up. The fear of death from the experimenting. At least it never occurred to me.
I mean, we're talking about really hardcore drugs here,
Yeah.
right? Well, Mary Beck says that this actually is a little bit part of growing up because the brain is developing in this age group. The way that the brain is developing is they're thriving on risky behavior. Unfortunately, it's just the stuff out there is so much more
There it
dangerous
is.
than what we were faced with. You know what I'm saying?
Yeah.
So give them an outlet. She says sports, rock climbing. She says her son goes to indoor air. We know that's not going to solve all the world's problems, but it's definitely a good thing to swap one rush for another and, keep them busy, right?
Yeah, when they're busy, they can't get in trouble the same way.
That's what I was always told.
Right?
we were booked from morning to night, right? And also analyze what you're considering experimenting. Experimenting, the experts say, is typically just a one-time thing. But if you're finding drugs hidden in their room, they're stashing it, they're storing it, that's not the first time that they've done it. That secretive behavior is one indication that they might even have a problem. So bite the bullet, seek help then, instead of waiting for it to be too late. The Council on Recovery, they take walk-ins. They also counsel families if you want to call them and ask how you should deal with a problem. But that's stuff that we were talking about, Bill Spencer had in his report about where is that they're hiding it. Things are just different now. Kids are getting a little bit more addicted to these things, I don't want to give any examples of what we might have done.
Right, because you hate to encourage it. I will repeat, just for the heck of it, what my father told me growing up. He said, smoke some pot if you want to, everything else will kill you.
And maybe
like, he kind of turned out to be right if you look at 23 states that have added it recreationally. But forget about that point. I think the scariest part as a parent, and I'll speak for myself here, you can't be there with them for that curiosity.
You can't be with them all the time,
You're not
ever.
there. When it happens, you're not there. Because if you were, it wouldn't happen.
I know. So, I mean, there's always that, like, criticism with parents, too. You know, oh, where are the parents? But we're parents, and we understand it is impossible to just hover over them and keep them in this
Nor would they
bubble.
want that. They have to become individuals. They have to learn to make the right decisions for themselves.
Right.
And what scares us, I think, is just the immaturity, the fact that it is out there and that it is so easily accessible.
And remember what Mary Beck said, their frontal lobe is not fully developed, and that's where your decision-making skills come in.
Right.
So, you know, you really have to help make those decisions for them in this time and really try and guide them in the right way, because chances are they're not going to make that decision on their own.